We now go to the gentleman from Texas, Mr. Farenthold.
Thank you very much. Dr. Gruber, you have the dubious distinction of having generated more buzz in the district that I represent than anybody but Eric Holder when coming up before this committee. And so I apologize if some of my questions are disjointed. Several of them come from Twitter, from folks who wanted me to ask a question. One I got was, why won't he answer the question? But I'm going to translate that more into, put my lawyer hat on and re-ask that. With respect to questions about the money that you made consulting on Obamacare from the both Federal and State government, you've constantly lawyered up or not answered the questions or not recalled. I want to be perfectly clear. This committee has government-wide jurisdiction. We are the taxpayer watchdogs. I am asking you right now, flat out, to provide a detailed list of every penny of taxpayer money that you have made from the government consulting on Obamacare, be it from the Federal government, be it from the State on a federally funded grant, or from a State. I am asking you to provide that within 30 days. And I would look forward to you providing it to the committee, and we'll work with Mr. Chaffetz, the incoming chairman, to subpoena that if it's not supplied voluntarily. So let me go on to a couple of questions. Do you feel bad about taking all this money from Obamacare from people you call stupid?
The money that I received from my economic consulting work was compensation for the quality work I did in economics and modeling, and so I think it was appropriate. Okay.
You worked, you had 21 meetings at the White House. You met once in the President's office. You talked to him. Based on what the information you provided, things you heard in this meeting, these meetings, and your general understanding, do you believe that the administration was truthful and transparent in the things they said working up to the passage of Obamacare, like if you like your health care, you could keep it?
I believe that the discussion of the Affordable Care Act was fully transparent, and there's enormous discussion of all of the aspects of the law.
Do you feel like, well, you know, you testified earlier that you knew there was going to be some churn. Do you feel like you were complacent in presenting the Affordable Care Act in a dishonest or untruthful manner, and is that something you would like to apologize for as well?
The numbers that I presented as part of my economic modeling to the administration and Congress were all to my best of my economic modeling.
But you knew some of the things that the administration were saying, some of the things in the debate were not true. Why didn't you raise a red flag? Wouldn't that make you complacent?
I'm not a political advisor. It's not my job to discuss what the President's saying or not saying.
Let me just, this is another question from Twitter. Did your insurance get more expensive? Are you paying more for it, or did your deductible go up?
Health insurance costs in America have gone up every year for the past 50 years.
Did yours go up substantially more when you fell under the Affordable Care Act than it had in past years?
No, it did not.
Mine sure did. Let me see, where else do I want to go? When you were talking to Mr. McHenry, you said that the Affordable Care Act did not solve the problem of rising health insurance costs. You went on to say that it was a first step. What are the next steps?
The next step really, in my view, is to learn from the first steps that are implemented by the Affordable Care Act, to learn what's working, what's not, and to try to build on that towards stronger cost controls in the long run.
So if you were to sit down and write a new Affordable Care Act 2.0, what would be the top 2 or 3 things you would want to include in it?
Right now, the number one thing I would say is that we need some time to see what is happening with what we did in Affordable Care Act 1.0, to learn from that, and then to not be in a rush, but rather to sit down having learned from that and take the next necessary steps.
Would you consider the ultimate solution to rising health care costs to be a single-payer or government-run system, a completely government-run system?
I don't think there is a single ultimate system to rising health care costs.
All right. Now, you've also been thrown under the bus by the President as just another advisor. I think I would be insulted by that, based on certainly by the Washington Post article that said how key you were to that. you want to come clean and just tell us if you told them any of the things that they were saying were untrue and who you told and tried to stop them. I guess that kind of loops back into my, my complacency question. Could you have stopped some of those untruthful statements, and why didn't you? And would you like to apologize for not doing that?
I'm not a political advisor.
All right. Well, I'll yield back. Thank you, Mr. Chairman.
I thank the gentleman. We now go to the gentleman from the Massachusetts Institute of Technology, Mr. Massey, and Kentucky, for that matter, too.
Yes, Kentucky. Thank you. It's been a bad couple of months to be from MIT, thanks to one of our witnesses. I've reviewed your extensive and impressive curriculum vitae. It's 17 pages long. And would it be accurate to say that you chose economics, particularly the field of economic models, to inform public policy as part of your career?
Certainly, one of the things I find appealing about economics is how it can help make informed public policy.
So you're in a position of trust. You've been to the White House many times. You've met with the President. Could you tell us again what you met with the President about?
I had one meeting with the President. There were 6 experts and about 15 other members of the administration.
And you were an expert on the how to control the costs?
Yeah, how to control costs and also to discuss health care reform in Massachusetts and how it works.
Was Independent Payment Advisory Board part of that discussion, or is that something that you would be an expert on?
I don't believe the Independent Payment Advisory Board idea existed at that meeting.
Okay, but you're very well aware of it and advise politicians on that.
I'm aware of the Independent Payment Advisory Board, yes.
So given this position of trust and the fact that you take taxpayer money, I have a question for you. Have you had any ethics training at MIT or Harvard?
As a condition for receiving Federal grants, we have to take a human subjects test.
So
MIT, a number of ethical issues.
And MIT has an ethics policy, correct?
Yes.
Okay. So this is a little bit philosophical, what I'm going to ask you now, but you're a doctorate of philosophy, so to speak. Under what circumstances is it ethical to deceive someone for their own benefit?
I'm not aware of circumstances in which that
Could you imagine maybe an adult could withhold information from children for their own benefit?
Yes.
Would there be ethical? Now, so if you understand that, then you understand why my constituents are so offended by your proposition that it's okay to deceive or obfuscate for somebody's benefit. Compounding the insult that you delivered to them is the fact that they pay your salary. So do you understand fully why it was so insulting? You patronized them. You were condescending.
I was.
And,
I agree.
And my colleagues on the Democrat side of the aisle are upset with you simply because you committed candor. You said what you thought. You said what they were all thinking when they wrote Obamacare, that they knew what was best for my constituents. I submit to you, my constituents are not your children, and they have the right of self-determination. So this gets me to another instance where you committed candor. In 1997, you co-authored a paper entitled Abortion Legalization and Child Living Circumstances, Who is the Marginal Child? On page 20, you conclude that abortion legalization appears to be associated with an improvement in the average living circumstances and birth outcomes among a birth cohort. And on page 26, you state that your research indicates that the legalization of abortion saved the government $14 billion in welfare payments through 1994. Is providing more access to abortion, is that a worthy social outcome to achieve cost savings for the government? That
is not what my paper was about. It wasn't a philosophical paper. It was about empirical facts.
Tell me what you meant by this sentence. By 1993, all cohorts under the age 18 were born under legalized abortion, and we estimate steady state savings of $1.6 billion per year from positive selection. What did you mean by positive selection? Because in this paper, you're talking about providing more access to abortions to a socioeconomic strata of our constituents.
What the paper did was look at—
What did you mean by positive selection in abortion?
In that paper, we were studying the characteristics of children who were born before and after abortion was legalized. By comparing those characteristics, you can infer the characteristics of the kids who were not born.
What you inferred, I find chilling. What you inferred is that if we reduce the number of people or children born, life will be better for the rest of us still living. Specifically, you seem to suggest that if we eliminate or reduce the number of poor people that are born, this will make life better for all Americans. And this gets me to my final point, which is the Independent Payment Advisory Board. My constituents fear that this is, in fact, a method by which Obamacare will ration health care for the elderly and therefore implement cost savings for Medicare. So my question to you is, does your philosophy on abortion, that it can save money and improve outcomes, have any implications in the realm of end-of-life care? You argue that abortions of poor children raise the average living circumstances in your paper for the rest of us and save the government money. So, Dr. Gruber, if there are fewer elderly people, particularly poor elderly people, wouldn't that save a ton of money too? As an economist, wouldn't you think that would save money too? And do you understand the dangerous implications of going down this path?
I have no philosophy of abortion. I have no philosophy of end-of-life care. My job as an economist is to deliver the empirical facts so that you all can make the necessary decisions.
What would your facts be on the elderly?
I don't understand the question.
The end-of-life care. Do you advocate that the Federal Government should ration that?
No, I do
As an
not.
economist, would it save money?
I do not advocate the Federal Government should ration end-of-life care.
Thank you. I yield back.
I thank the gentleman. We now go to the very patient Mr. Meadows.
Thank you, Mr. Chairman, and it has been a privilege to serve under your leadership, truly an honor. Dr. Gruber, I'm going to come to you because you have made over 20 statements this morning that you are not political, and yet I think the American people, if they're viewing this morning, they would see your testimony is political. It is contrived, it is orchestrated, and honestly not transparent. You have prepared for this testimony this morning with your counsel, is that correct?
Yes.
How many hours does it take to be transparent and honest of preparation? How many hours of preparation does it take to be honest and transparent with the American people?
I don't understand the question.
Why would you have to practice your testimony in order to give an honest, transparent answer to the questions posed to you today? Why would you have to practice? Because you have practiced, because you've said the exact same thing, glib, those words, you know, they're not heartfelt. You've practiced that, haven't you?
I have practiced, but I disagree that they're not heartfelt.
Okay. So let me ask you about your economic model, because you said it was accurate. So how many, in your economic model, how many Americans would lose their health care, could not keep their plan as the President promised under your economic model?
I don't recall the exact number.
So you can recall all these other figures, but you can't recall that one?
No, I can't.
Okay. Well, can you get that to us?
Once again,
Oh, you don't want to get that to us?
once again, that depends on—
Can you get us the number in your economic model of those that were not going to be able to keep their health care? Simple yes or no.
I don't know.
So you don't have it in your model.
I don't know whether I can or not. You'll have to take that up with my counsel.
Mr. Chairman, I see this witness as being very reluctant to give honest answers, and it is very troubling, not just to me, but to the American people. Ms. Tavenner, I'm going to go to you because the administration didn't want you to sit beside Mr. Gruber because they were afraid that his lack of transparency would be contagious, I guess, or you would be viewed in a different model. I'm troubled because I asked you some questions at the last time you appeared before this committee. And I asked you at that particular time about a rollout, and we went back and forth, and why did you not delay it? In your response to me, it says from Ms. Tavenner, well, I didn't think it was possible the way the FFM was configured to do that, nor did I think it was necessary. Do you stand by that today?
I stand by the fact that I felt we were in good position to roll out last October.
Okay. Yeah, I'm in, and I'd ask if you could put up the slide, if the staff could put up the slide, but I'm in possession of an email stream from your second in command and Mr. Todd Parks that goes back and forth. This email stream was less than 48 hours before rollout. It was on September the 29th. And in that, it says, just so we're clear, Ms. Tavenner decided in January that we were going to go no matter what. It goes on even further to says that, hence the really cruel, uncaring march that has occurred since January when she threatened me with demotion or forced retirement if I didn't take it on. Are you familiar with this email?
I was not copied on that email. I have since seen that email.
All right. And so your number 2 person, because in the email stream, if you've read all the stream, it was indicating that you weren't ready, and yet it didn't really matter.
I don't happen to agree with that.
So it does matter. So in that same email stream, we were putting together hardware. We were installing hardware less than 48 hours before a rollout so that we wouldn't have a crash on the rollout day. Did you not see that as troubling? That we were installing, with less than 48 hours to go, we were installing hardware that wouldn't be tested.
We were installing hardware to increase capacity.
Right. I got the numbers. And so, but you don't see that that's troubling when you're rolling something out, that you wouldn't be ready when you're going to put in a piece of hardware just less than 48 hours?
We had tested, and we were increasing our capacity to handle more volume.
All right.
I would not see that as troubling.
And so this Ms. Snyder, is she with you today, or she was forced to retire?
She was not forced to retire. In fact, during the
Is she retired?
She is retired. Her choice.
She just wasn't forced to retire.
She was not forced to retire.
All right. Let me close by this. I sent your staff the information with regards to almost 4 million people that, if they do not re-enroll, will get hit with a tax bill some 10 to 12 months from now, if they do not, because their benchmark plan has changed. Are you notifying those almost 4 million people that they may get a tax bill if they do not re-enroll, individually?
We are individually notifying folks about the
Well, that's
importance of
funny,
coming
because
in.
I have 17 counties I represent, and not a single one of them have gotten individually notified that they're going to get a tax bill.
So they are individually notified that I did not get a chance to finish my sentence.
Oh, I'm sorry.
Yes. They have been individually notified that they need to come back in to return to the marketplace to update their information and make sure that, A, their information is current, and B, that they're selecting the plan.
That's a general marketing thing. You already
No, it's
responded
not
to
a
that.
general
Well,
marketing.
it is,
It's
but
an
let me tell you.
individual letter and phone calls to.
But individually, you know who is going to get a tax bill. You know that today, if they do not re-enroll. So why do we not notify them that if they automatically renew, they will get a tax bill?
Well, first of all, I don't know that that's necessarily true.
Well, talk to Dr. Gruber, because it is part of the plan that your premium, the rebate you get, whether your income changes or not, is based on selecting the benchmark silver plan. If the benchmark plan changes, and I would think that you would know that, you're over this, if the benchmark changes, then indeed what the amount of money that you get back will be incorrect.
So the benchmark is just one thing that changes, right? There's lots of other things that can change, that would change your tax liability or your tax.
I understand that. But what I'm saying is, someone who makes the same amount of money, stays on the same plan, got a rebate this last 11 or 12 months, they will get a tax bill unbeknownst to them by doing nothing.
I think that You're assuming, I assume you're talking about 2016, not 2015.
No, this open enrollment period right now.
That's not true.
Oh, and why is it?
Because
I'm all ears. I want to tell the folks.
First of all, the individuals who signed up in 2014, if they have a tax liability or tax credit, that will be in April of 2015.
I understand that.
Individuals that you're talking about now who are signing up for 2015, if they were to have a tax liability at all, it would be in April of 2016.
That's correct. But that's what I'm saying. They're going to get a tax bill if they do automatically renew by February. If they don't,
Not necessarily. It depends on
so
what's
they
going
can
on
change
with
their
the
plan
individual.
after February.
They cannot change their plan after February, but whether or not they have a tax liability is going to depend on each individual, which is why what you are trying to say is part of what we are stressing to individuals. Come back, update your information, look at a plan, shop, select, but when they did their original plan, they also understood that they are to update income, changes in family circumstance. There's lots of things that can affect it.
I understand that.
That's all I have.
But what I'm saying is the benchmark plan in the counties I represent will change because it's a different carrier. If they do not go in and select the new plan,
Well, first of all, if they don't select a new plan, we don't move them to a new carrier.
right, they will be automatically renewed. I appreciate the patience of the Chair.
No, and I appreciate the gentleman from North Carolina. I think the gentleman made the point that every American has to, independent, because he or she is not getting this information from CMS, they have to independently ask whether or not they're getting into a tax booby trap, into a tax landmine by just automatically renewing. And I think the gentleman's point is good. I'm afraid Ms. Tavenner doesn't want to admit that some people are simply not going to know, and she said, rightfully so, well, it's their responsibility. Well, it was never somebody's responsibility to know that they might be getting into a tax consequence before the Affordable Care Act. They now need to know that. We now go to the gentleman from Michigan, Mr. Bentivilio.
Could I answer that? Because I think you'll
No, ma'am, you may not. I was no question there, honest. I was
There's
simply talking.
piece of it missing.
I was talking to the gentleman. We'll give you plenty of time. We're not going to end this thing until you've had all your say, ma'am. The gentleman from Michigan.
Thank you very much, Mr. Chairman. Mr. Gruber, Ph.D. from MIT, correct?
No, my PhD is from Harvard University.
Okay, Harvard, another prestigious school as well, and you teach at MIT.
Yes, I do.
Very prestigious school. Myself, I graduated from a small college. My dad was a factory worker. I had to work my way through college, but I understand it's very prestigious, and congratulations. But I want to go back. Earlier, there was some people on the, you as well as members of Congress, stating that this was very transparent, this bill. And yet, from the very beginning, if I remember correctly, a lady got up in front of the floor of Congress and she said, you got to pass it before you can see what's in it. Do you remember who that was?
I believe that's a quote attributed to Nancy Pelosi.
Correct. Thank you. And yet it was 2,700 pages, the original act, and if you read that 2,700 pages, you're going to see a lot that says to be determined in that bill. So the bill wasn't really complete. So how can you have a bill, pass a bill, before you can see what's in it, and call that transparent? Because I didn't get to see it, well, I wasn't here, but other members of Congress really couldn't see that. And then we find out now that, well, we were told that you can keep your insurance and you like it, and we know that's a lie. You can keep your doctor, and we know that's a lie. And you can keep your hospital, and that's a lie. Lies on top of lies. And it's not really about health care either. It's a tax. Premiums will be lower, and yet they're higher. Another lie. So let's backtrack. You apologized today for some comments you made in the video, correct?
Yes.
Okay. And it says several times here you said you apologize for insulting others to make yourself look smarter or better than others. Or that's paraphrasing, but that's pretty much what you said. Is that correct?
Yes.
You want to repeat what you actually said? Go ahead.
No, what you said is a good paraphrase.
Pretty good. So let's be clear. You did not apologize for helping the administration deceive the American people on this Health Care Act or for telling America the truth in your video comments about how it was a fraud upon the American people. Is that correct, sir?
I think the Affordable Care Act was passed in a highly transparent fashion with hundreds of hours of debate.
But every single thing they promised was a lie. How can you call that transparent? You didn't say what we're about to do for you is not going to really do you any good. You're not going to keep your doctor. You're not going to keep your hospital. Your premiums are going to go up. Why didn't you say that? You were the architect, one of the architects. You created the model. Is that model flawed?
I did economic microsimulation modeling that I believe is
simulation. So you actually created a model to justify their conclusions. Seems about what you did. I mean, you're a lot smarter than I did. Now, here's an opportunity for you to come clean. Lies on top of lies. This is what you have done. You have been a co-conspirator in defrauding the American people, and you admitted it in 2 videos and comments that I saw on TV, and I saw some here today. In helping this administration deceive our citizens, you received grants and contracts from the government, for either the Federal Government or the States. Was it closer to $2.5 million or $2.8 million you received over the course of implementing this Obamacare?
I don't recall the exact figure.
You're an economist. You know the quotes you said in the book you wrote. You know how to balance a checkbook. You know how to read a balance sheet. Was it 2.5 or 2.8 million or more? Plus or minus $100,000.
Once again, I don't recall the exact amount.
Now you know what? It's about lies, half-truths, and distortions. Why are you continuing to help this administration deceive the American public? With that, Mr. Chairman, I yield back.
Well, if I could have the time for just these 40 seconds, and I thank the gentleman. You keep saying you don't recall. Do you not recall any numbers at all? I haven't seen a number you can recall since you gave us that approximately $400,000 in your opening statement. You're an economist. You work with numbers. Why is it that every question that comes from this side of the dais, we get a don't recall, Mr. Gruber?
The $400,000 is a number I recall very well because it's been made very public. The other contracts and other things I receive from States and the Federal Government are numbers that I don't have at my fingertips, but numbers that the committee can discuss with my counsel about what's appropriate to reveal.
Well, you're making it very obvious that we're not only going to have to discuss with your counsel, we're going to have to serve a subpoena. We're going to have to demand these numbers because you're not even giving us a fair estimate of the approximately $4 million that you said in your earlier statement, well, this is excess and it didn't all come to me, but you haven't answered one question about grants and contracts. I never knew anyone in business who got even a small amount of something that didn't know about the grant or the contract gross value and then what they got from it. And it's amazing that you haven't given us one in numbers since that chosen amount, and that is a little disturbing. And I will caution you one last time as these individuals ask their questions that the goal was to get completed here today with sworn statements about numbers to the best of your recollection. Approximate was good enough. But the fact that every answer is, well, discuss with my lawyer, puts this committee in a position where it is very clear we're going to have to do more discovery, and likely you're going to be back here again under the new chairmanship. So, Mr. Bentivoglio, did you have one last question?
Thank you very much, Mr. Chairman. Just one last question. I understand, according to the Supreme Court, this is a tax, correct? It's a tax.
As I said earlier, I don't believe the individual mandate is.
Okay, but it's a tax for failing to engage in commerce, because if I don't engage in Obamacare, go on the website, I'm going to be taxed or fined, correct?
The individual mandate assesses a penalty on you if you don't get health insurance unless you meet certain exemption criteria.
I'd like to find some other examples of somebody being taxed for failing to engage in commerce. It's kind of like me going into my local grocery store, walking around and not buying anything, and a Federal agent's outside the grocery store saying, hey, we're going to tax you because you didn't buy anything in that store. Thank you very much, Mr. Chairman.
I thank the gentleman. We now go to the gentleman from Florida, Mr. DeSantis.
Professor Gruber, do you deny, it's been reported that you've received $3, $4, even $5 million with your contracts from the various state governments, many of them $400,000, $500,000 a pop. Are you saying you have no recollection of that, and do you deny those reports?
What I'm stating is the amounts that are reported are greatly in excess of what I received, in particular through Federal grants, but I don't know the exact.
Is it in the millions, though?
Once again, I don't know the exact amounts.
Okay. Well, I mean, look, you really further undermine your credibility. I would think that you would be able to give us a ballpark. I mean, it's going to be subpoenaed. We'll go through the exercise. The American people will eventually get the truth. This idea of you denying that you're the architect of Obamacare, I'm just wondering, you know, you've been lauded in the press in the past as the architect. There was an article in the New York Times, 2012, dubbed you Mr. Mandate. There's a quote from it that said, after Mr. Gruber helped the administration put together the basic principles of the proposal, the White House lent him to Capitol Hill to help congressional staff members draft the specifics of the legislation. So that's more than just providing some numbers. And so the question is, if what you're saying is true today, that you're really not the architect of the law in any real sense, did you tell any of those reporters that they were inflating your role back in 2009, 2010, 11, and 12?
Yes, I did tell a number of the reporters they were.
And were there any corrections ever made to the record?
I don't know.
Okay, because this is pretty consistent media treatment. Now, you testified that the comments about eligibility for tax credits if the state didn't create an exchange, that you made that comment because you weren't sure the Federal Government would actually set up an exchange, and that was in Falls Church, Virginia, January 2012. And that's your explanation for that, correct?
Well, as I said at the time, I don't recall exactly what I meant when I made that statement. Looking back at the video and thinking about how I could have made that statement, I believe that's what I had in mind.
Because it's interesting. If you go further on in your comments, you say, quote, the Federal Government has been sort of slow in putting out its backstop, I think, meaning you think, partly because they want to sort of squeeze the states to do it. So that's the comment that you made. And so even under that construction, you're saying that the Federal Government is deliberately slowing the creation of the exchange so that more states will do it. Ergo, there must be a consequence for the states if they do not do that. So I don't think your explanation here today really resolves that. I think you still have made comments from your perspective in terms of what you want to do politically are still problematic. With some of the other comments you were making with this lack of transparency, I just want to be clear. What you were trying to say, I think, is that the bill is convoluted. You agree it's a very confusing statute, correct?
It's a very complicated piece of legislation.
And the reason why it had to be written that way is if you were straightforward about imposing costs on one Americans and then giving benefits to other Americans, that would have run into political difficulty. And so the costs are still being shifted to other Americans, but they're being shifted under Obamacare indirectly in a way that essentially masks what's happening. Is that basically the deal?
That's a very broad statement. I generally don't agree with what you just said.
So you don't believe that Obamacare's convoluted nature serves to mask the true cost to individual policyholders?
No, I do not.
So when people are paying more for their premiums, and you did a report to Wisconsin in 2011, and you estimated, even though you had said in 2009 that premiums would go down across the board under Obamacare, your report to Wisconsin in 2011 said actually individual market premiums will go up on average 30% relative to what they would have been had Obamacare not been passed.
The report I did for Congress was interpreting CBO numbers, not my own, which discussed the fact that premiums would rise.
But the report to the State of Wisconsin said that they were going to rise, correct?
After tax credits, they fell on average. That's what my report showed in Wisconsin.
You said the average premium. Most Americans don't get tax credits, though. So the average premium increase in Wisconsin, correct?
That was referring to the individual market in which most Wisconsinites will get tax credits.
But many of them won't. So thank you. I yield back.
Thank you. We now go to Mr. Collins for his round of questioning.
Thank you, Mr. Chairman. I appreciate the time and the opportunity to be here. Mr. Gruber, words cannot express today. Basically, I frankly didn't think it could get worse. Congratulations, you got worse. Coming in here with the attitude that you've had, and I'll talk to my attorney about money I've earned. Did you actually file a tax return last year? That you would actually have to qualify your income? Frankly, I and the American people, I am good to know one thing. that by implication, voters who did not like the Obamacare plan did not vote for it, or probably not the stupid ones. And so my district, which voted against the President, almost 80%, is full of what you would consider non-stupid people. I'm done with you. Ms. Abner, got a couple of questions. And I'm going to go fairly quickly here. Let's run through these. How much money was paid to insurers under the Affordable Care Act program known as the Cost Sharing Reduction Program in fiscal year 2014?
I don't have that information.
Were you not briefed?
On the cost-sharing payment?
How much money was paid in 2014?
I have not been briefed on that, no.
You do not have reports that could get you that information?
I can get you that information.
Are you in charge of this program?
I am in charge of this program.
And you do not know how much is paid out?
I do not have that with me today.
Do you have someone that can find that information while they're handing you notes from behind? It is amazing to me you run a program that is this large that you can't answer questions. You and Mr. Gruber don't need to sit beside each other because it is wearing off. Number two, how much money is paid to insurers under the cost sharing reduction program in fiscal year 2015 to date?
I don't have that information.
Are you not briefed with this? Did you not get a spreadsheet? A monthly spreadsheet?
I will be glad to get you that information.
Not my question. Answer my question. Do you get a briefing on this?
Do I get a briefing?
Do you get a briefing that resembles something of this effect where they're actually asking for it on a regular basis?
I do get briefed.
Okay. Do you listen during those briefings?
I try to listen. I have a lot of information to listen to,
so do I.
Listen.
So do I. But when you're also subpoenaed, brought here to a hearing.
I was not subpoenaed.
You come in voluntarily. Thank you for that.
Thank you.
But the problem we have here is there seems to be, when we get here, we only want to answer the questions we want to answer, not questions that are part of your regular job. Let's continue on. The Wall Street Journal recently reported that insurers participating in the 2015 ACA exchanges insisted that their contracts contain a clause permitting termination of contracts if the cost-sharing reduction payments or refundable tax credit payments ceased. Number one, is this report accurate?
There is information in the contract, and I'll be glad to get you that.
So that would be yes?
I believe I said yes.
No, you didn't. Who negotiated these contracts with the insurers? I didn't hear your mic on.
It's done by staff and attorneys within CMS.
Do you approve those?
I do not approve individual contracts, no.
Will you provide for this committee the names of those who negotiated these contracts with the attorneys?
I would be glad to get you information.
No, and I'm going to just ask the question, not to honestly to be funny here, but I do. But given the glacier pace of response on other things, and also the fact that when you testify before Energy and Commerce, they're still waiting for numbers from you. Do we need to go ahead and subpoena this information now?
I believe I've gotten you information as you requested it.
I've never requested information from you, Ms. Tavener. I'm listening at your history.
This committee.
So let me ask the question point blank. Will you get it in a timely manner, not glacial pace, not biblical, within the next few days?
I will get you the information as soon as I can.
Do I need to subpoena them?
You have not needed to subpoena me in the past.
We just have to wait forever. When were these contracts negotiated?
These contracts were negotiated over the summer, and I'll have to get you the specific dates.
Okay, please include that in your information. Did every insurer participating in the 2015 ACA exchanges receive such a clause in their contract?
I believe the contracts were consistent, but I'll get you that information.
Okay. Will you provide a copy of all these contracts?
I will work with you. I will have to talk with our counsel, but unless there's a reason not to, yes, we will get you.
Okay, and without being editorialized here, why would there not be a reason to provide these contracts?
I don't know that there is. I said I would work with you.
Okay. Again, we're having, maybe it's a disconnect between here and there, and honestly, I'm not trying to be argumentative at this point. But you actually do work for the government. You do work for an agency that is under jurisdiction of this committee, under this oversight provision of transparency and everything else. Why would you even have to hesitate on providing contracts that are public monies are spent on to this committee?
I don't think I would. I just asked that I would be able to ask that question.
To who? You run the department.
Counsel. I'm not an attorney.
Well, that's not a bad or a good thing. My question is, you run the department.
I run CMS, yes.
Yes. How many attorneys do you have working for you, besides the ones that came with you?
I don't have any attorneys here with me.
Okay, maybe there's our problem. All right, let's, at this point, but again, I'm not unsure why we can't answer that question. Let me reverse back. We know when we've determined that you do get briefings on insurers asking for Federal Government to pay for them under cost sharing reduction. CMS asks insurers to submit on a monthly basis pre-populated Excel spreadsheets that contain this information, correct?
That is correct.
Thank you. The amount of insurers asked the Federal Government to pay them under cost sharing reduction is an individual line item on the spreadsheets. Is that correct?
I believe that is correct.
Thank you. Wait, I had one question here. There is an issue here, and I want to go back to a question. It says, I want to know who made the decision not to request appropriations for cost-sharing reduction program for fiscal year 2015?
That is not within my purview. I can't answer that question.
Do you not have to adjust and spend the money that was supposedly appropriated for this program?
I do not. That is done through our financial department. I'll be happy to get you.
Can you provide anyone, would your financial department have participated in the decision not to ask for appropriations in 2015?
I don't have that. I'll be glad to get you that information.
Okay, so again, under your leadership, this is a department that is basically going rogue and doing their contracts that don't report back to you, or budget items.
I will be happy to get you that information.
That must be hard to say every time, when I know you understand this. It must be that difficult. Who did participate, and will you provide those names?
I have told you I will get you that information.
Is there anyone outside that we need to ask? Was this OMB, Treasury, White House, anyone else who would have determined not to ask for appropriations for this program in fiscal year 2015?
Once again, I will go back and try to get you the information.
So you have no idea when these meetings even took place? Would that be a fair statement?
I cannot answer your question. I will try to get you that information.
Gentleman's time has expired. We now go to the gentlelady from Wyoming, Ms. Loomis.
Thank you, Mr. Chairman, and thank you for your leadership these past couple of years. We appreciate your hard work on this committee. Dr. Gruber, did you participate in the scoring aspect of the Affordable Care Act?
I provided economic microsimulation results to the administration and Congress to help understand the cost and coverage effects of the law, but I did not provide any official scoring.
Well, you have stated that the ACA was written in a tortured way, so CBO would not score it as a tax. Now, how did the administration use your information to write the ACA in a tortured way so CBO would not score it as a tax?
Once again, I apologize for my inopportune, just inappropriate terminology.
Well, but they didn't score it as a tax, right?
The administration, I did not draft.
How did you do it? How did you get CBO to not score it as a tax, knowing that at some point you might have to get the U.S. Supreme Court to say it was a tax? How did you do it?
I don't run CBO. I didn't draft the legislation.
What does CBO stand for?
Congressional Budget Office.
And what is scoring?
Scoring is the method by which the Congressional Budget Office estimates the effects of legislation on things like the Federal budget.
You have said in 2012 remarks at Noblest that you wrote part of Obamacare yourself. What parts did you write yourself?
If I said that, that was once again an effort to seem more important than I was.
Well, why would you say you wrote part of Obamacare yourself, and you're the numbers guy? They used your modeling, and they knew they might have to convince the U.S. Supreme Court that it was a tax and convince the Congressional Budget Office for scoring purposes that it was not a tax. How did you do that?
Ma'am, once again, I did not write any part of the Affordable Care Act.
Well, why did you say in 2012 explicitly that you wrote part of Obamacare yourself?
I was speaking glibly.
How many non-politicians know what CBO is? How many non-politicians know what scoring is? How many non-politicians would know that you have to get by CBO scoring in order to get the Affordable Care Act to say that it's going to lower costs. You are a politician. Everything that has led up to your testimony today is inconsistent with your testimony today, which is to say all of your prior statements were a lie. Is that true? Were all of your prior statements a lie, or were they just glib?
They were not a lie.
I want to change subjects and visit with Ms. Tavener about something that you'd begun to discuss with Dr. Gosar, and that is there a decline in participation? Is that what has yielded smaller increases in the cost of health care?
I don't have an answer to that, and I think we'd have to wait for someone. It's too early to know.
Is there a way to analyze the information to get that fact, to determine it?
I think if you look at the Medicare trustees report, if you look at the national health expenditure, it will show you trends.
Okay, I'm hopeful to get those trends. I'm going to give you a little story. I'm on Obamacare. My husband was on Obamacare with
in passing the Affordable Care Act.
I believe the Affordable Care Act was debated extensively, and there was a very
So
transparent.
you were lying in 2012.
In 2012, I was conjecturing about political things.
Well, that was what you said just now is in direct opposition to exactly what you said in 2012. So it was a lie today, or was a lie in 2012. Which one's a lie?
I believe that the Affordable Care Act was passed in a transparent.
So you were lying in 2012 is what you're saying.
2012, I was trying to play amateur politician, and I shouldn't have done that.
I think the gentleman, I gather the gentleman is really saying amateur politician, in which, as a politician, you're allowed to say things that just aren't true out on the stump, and then when you're under oath, you say the truth, right?
Yes, sir.
I gather. I thank the gentleman for your participation.
Thank you very much.
Appreciate it. I'm going to try to get this done so we can recess. We have a vote on the floor, but Ms. Tavener, can we get the cost-sharing reduction payment figures requested by Mr. Collins in the next 10 days? This is fiscal year 14 plus 15 payments to insurers. Could we be assured that we'll have it in the next 10 days?
So it would have the 14 payments.
Right, FY14.
Yes.
Yes, good. Can we get copies of the revised insurer contracts with which include the opt-out clause within the next 10 days?
Yes.
Thank you. Has any insurer participating in the 2015 Affordable Care Act exchanges expressed any concern at any time to anyone to your knowledge in the executive branch of the Federal Government regarding the lack of an appropriation of funds to make cost-sharing reduction payments to insurers?
Not to me. Okay. And I'm not aware of anyone else, but definitely not to me.
Okay, but you know of no question from any insurers? You haven't heard through staff or hearsay?
Cost-sharing reductions, no.
Okay. Mr. Gruber, I'll be quick. You were familiar with CBO, you sat on the advisory board, and you made this comment about tortured scoring. I know the tortured scoring, so let's go through it very quickly. Isn't it true that the Affordable Care Act received revenue in years in which it was paying nothing out, which allowed in the 10-year window for it to have revenue that on a long-term basis would not fail to have a deficit? In other words, by collecting a tax before they began paying out, that shifting in the 10-year window causes the 10-year window to show a balance that disappeared later, but a balance that in the next 10-year window would not exist. Isn't that true?
The Affordable Care Act did have revenue-raising provisions which started before 2014, but it lowered the deficit overall in the first decade and by an increasing
Yeah, we're not worried about the deficit, but that's the tortured stuff you were talking about, is that because they were able to not score certain things as expenditures, make certain assumptions in there, and most importantly, collect revenue, which was during a period in which they were paying nothing out. That gave them a score of revenue that, in fact, on an ongoing basis, in other words, if they started on the day that the Affordable Care Act began providing services, and took only the revenue during that period, they would have had a deficit. Isn't that true?
If they started the day the Affordable Care Act began and they went for the next decade, they would have showed a massive surplus.
You're saying that, in fact, are you sure you want to say that as not your knowledge, that in fact, today, for example, with the payout and the in, you want to say that the incremental Medicaid payments and so on that were caused as a result of the Affordable Care Act would, in fact, have had a surplus, not a deficit in revenue?
My recollection of the numbers, and I haven't looked at them in a while, my recollection of the numbers was that by the end of the decade, that on a year-to-year basis, the Affordable Care Act significantly lowered the deficit, such that if you add up to 10 years after 2014, I believe that if you go by CBO's numbers, that would have been deficit reduced.
You are aware that CBO has revised their numbers and they now show a deficit in the Affordable Care Act, and have since really shortly after the parties changed here in the House and they redid their numbers. Ms. Tavenner, are you aware that they show a deficit, that CBO has revised their numbers? They no longer stand behind the numbers during passage?
I'm not aware.
I sure wish you had been aware of it. Mr. Cummings.
You had not heard that? I hadn't heard it either.
I don't think so.
But we'll check on that. Just as I close, let me just say this. One of the things that I think about and talk about the older I get is that we have a limited amount of time to be in these offices. And I'm so sorry, Mr. Gruber, that you said what you said. You can call it conjecture, whatever. And I'm so sorry that the mistake was made. And I do believe it was a mistake. But what it does is distracts. It distracts from all the good things that are being done with regard to this law. And that is the most painful part of all of this. I talked to a lady the other day who had to wait for the Affordable Care Act to go into effect to get breast cancer treatment. I mean, I can just story after story after story. And now we've got to spend all this time dealing with something, Mr. Gruber, that you were conjecturing about. I just told my staff, I said, we ought to learn from this. You got to watch what you say. Watch what you say, because it can lead to significant consequences. And I was so sorry to hear about Ms. Loomis's husband. And I knew you wanted to say something. I was just curious. What did you want to say, Ms. Tavenner?
So first of all, I wanted to express my sorrow at her loss, and that we would follow up with the D.C. exchange to see what had happened.
Yeah.
That's cold comfort now, but.
Yeah, it's a painful story.
Yes.
But, and so, anyway, again, Ms. Tavenner, I hope you'll go out there and you'll continue to work hard to make this work, no matter what happens in these hearings. We've got to protect people's health. We've got to try to keep people well and help families stay strong, because I think that when we have an unhealthy population, we have an unhealthy country. And, Mr. Gruber, you call it amateur politics, whatever you want to call it. Like I said, I think the most painful thing, and I always try to keep sight of the big picture. My mother has a saying. She says, big can't get you if small's got you. And I think sometimes we can get so caught up in distracting things that we don't deal with the bigger picture, the life and death situations. And so, but thank you all once for your testimony.
I'm going to close the hearing. Mr. Goldman, thank you for your participation. Thank you. Yeah, thank you for your participation. I suspect that this is an unusual event for you, and you carried yourself off well, even though there weren't as many questions. Perhaps if you'll post a few videos, you will get an opportunity. Mr. Gruber, I think you saw here that on both sides of the aisle, at least a number of members don't buy that you were saying one thing there that you didn't believe. I think most of us believe you believed a lot of what you said. And in the case of the tortured accounting that CBO used with 10 years' worth of revenue and a fraction, only about 6 years' worth of payout, it was tortured. It is tortured. And the American people in the long run are going to realize there's no free lunch. And paying 100% and then later 90% of Medicaid payments as the major part of the new insured under Obamacare has a cost, and has a cost to the taxpayers. And the taxpayers are who we represent from this side of the dais. Ms. Tavenner, the only reason you're back here today is that you came with figures that were deceptive, needlessly deceptive. We can take bad news here. We've overseen a lot of agencies, problems at the Department of Transportation, problems at the Secret Service and others. Mr. Cummings and I have been able to work without endlessly bringing people back when there's open and transparent delivering of information. Now, you made some specific promises of delivering information today. I trust that you will keep those. I will tell you that no matter who sits in this chair, and I've sat here under 5 chairmen, or 4 chairmen, and I can tell you Mr. Waxman would have been just as animated as we are here today, that give us the bad news, give us what you have, even give us bad information. In the early days of the stimulus package, we were told there were congressional districts in numbers greater than existed. And we laughed a little bit and we had hearings, but at the end of the day, working with Earl Devaney and other people, we accepted that they were giving us the best information, and when we saw mistakes, they corrected them. You have that opportunity. I won't be in this dais, next Congress, but somebody else will. And when they call you back, tell us what you don't know early on, not when we ask for facts later on, and that will be helpful. I've said all along that the problem in this administration is that they didn't live up to their promise of being the most transparent administration in history. The standard, the bar was low. All administrations have a tendency to deliver good news in press conferences and bad news at the latest possible date. So I want to thank my ranking member. He said earlier that I made him better. Well, I will tell you, Mr. Cummings has worked very hard to make me have to be better in trying to get to the truth. And I've learned a great deal. And I will just say one thing in closing to my friend. I would do things differently with what I now know, but I would hope that anyone who sits in this chair would never do less than I have done, because it is our watch, it is our time, and I think you and I have worked hard to try to make sure this committee did as much as it could, and my only regret is that we couldn't do more. So I want to thank you. Thank you. We stand adjourned.